Dr. Crowley, what is C.O.R.E.S testing and what does it consist of?
At our clinic, we offer a C.O.R.E.S test, which is a test done by the blood. Just general blood sample is taken and sent out to the specific lab. And in that test, we can assess whether person has a coronary artery disease, any real blockage, and what is the probability of the coronary artery disease. But for that, person should have some typical or atypical symptoms suggestive of coronary disease or risk factors. Two or three more risk factors also be there that could become indication for this test. The importance of this test that we don't need to do very detailed test in case they are really negative. Then we can say with a pretty good certainty that probably there is not the symptoms, atypical symptoms or typical symptoms are not from the coronary artery disease, and we should look for other things. Uh, Also, it looks at some genetic specific genes that occurs when you have a blockage in your arteries. So it's a very simple test, mostly used in a chronic setting. Patients think they have it, but very low probability of having coronary disease in those patients is very important to get those tests done to prevent further worries and further testing. So in our website, we have put detailed information, and you can access more information, so you can have a better idea what are the indication, why we can use it, how it is helpful. You cannot use the test if you have diabetes, because in general diabetic people already have a high risk of coronary disease. Also, you don't want to use this test if you already have some coronary disease from the past, if you have a stent, because you already have a disease, so the test will be positive most likely. So it's not a very good that are the possibly exclusive thing. You don't want to use this test if you have diabetes or already coronary disease. Otherwise, very helpful test. We've been doing it, and it puts patients' mind at rest, in our mind at rest, because sometimes most of the time in the outpatient clinic, we see patients, they have a uncomfortable pain, uncomfortness in the chest, but not really difficult chest symptoms. And if you don't want them subject for detailed testing, it's quite a helpful test.